We'll start over. Good evening and welcome to Disability Awareness Day 2022. My name is Sarah Launderville and I'm the Executive Director of the Vermont Center for Independent Living and the President of the Vermont Coalition for Disability Rights. My pronouns are she and her, and my visual description, I'm a white woman with medium length brown hair and glasses, wearing a teal top in front of a red curtain. I was thinking this morning about how sad I am to not be in person with you all this year, and that this now is our third year away from one another on Disability Awareness Day. I miss being able to catch up with each other and just be present, eating lunch in the cafeteria and sitting in committee rooms, supporting each other as we tell our stories, our struggles, and our moments of joy. See, Disability Awareness Day has never only been a time to share and teach our legislators about our advocacy priorities within our coalition. It's always been so much deeper than that. An opportunity for us to come together, to relate to one another, and feel pride in being part of a community. An opportunity for us to support one another as we testify about awful discrimination, extremely difficult life issues, and solutions we know that can work. And it's a time when we have hundreds of disabled peers together in one location, side by side, connecting. I was recently testifying about one of my first Disability Awareness Days came up. And I shared with the group of people that a longtime senator came up to me on one of my first Disability Awareness Days and said, well, what's your disability? Sorry, my thing went away. And I was taken aback. I wasn't sure in that moment how to respond. I was new to the work, and I knew from other times when I shared about having a psychiatric disability that people would literally back away from me. And I was there to bring awareness. And what I remember most about that day, about 25 years ago, is that one of our VCIL board members and an advocate and now friend, Ed Paquin, listened to me. He listened to my insecurities, my fears, and my anger. And he offered some advice that I still use to this day. I can tell you story after story of Disability Awareness Days in the past that my memory of peer support, love, and community is what I hold in my heart. I can also think of all those years and all those successful moments that we've had as a community and witnessing laws change because we expressed our experiences. And this year will be no different. We will use the resources at hand and testify, sharing solid solutions. Our legislators will listen and help implement those changes. And our world will continue to improve, and our collective coalition will help make everything stronger. I watched my social media newsfeed yesterday as some of you were sharing about the event tonight and how you would be able to contribute by testifying, recording your story, or simply inviting a friend to understand what you go through and the barriers that you face. I felt such a sense of community as person after person shared how they could help legislators understand our lives. And then I watched the registrations come in and saw legislators and leaders of state government and our federal delegation register for our event. And all of us together tonight, we're here to share, listen, and act on legislation that will ensure equity for people with disabilities. As we think about our theme, open to change, open to all, we know that we need to disrupt the systemic issues of ableism, autism, and saneism, and build systems, structures, and a world that take shape differently than where we have come from. We've been saying for years that we need insurance coverage for hearing aids and dentures. That will help us be open to all. We've said in order to have a stronger workforce, we need personal attendance services, not connected to asset limits like the PDAC program. We know that there are 17,000 available workers with disabilities in our state that can help us with the projected loss of 25,000 workers in the coming years. And that with supports and access, our time has come to fill those job opportunities. We know that parents with disabilities who have lost their children just because they have a disability, because of the ableism that's built into our systems. And we have been saying for years that properly funded peer supports and mental health will decrease harm. As the legislature is moving to take steps in reconciliation regarding the eugenics movement and the gross harm to our community, we must be included in that work. To be open to all, we need real reform that pushes forward and allows people with disabilities a world in which we have access and equity. Before closing, I want to thank our legislators who came tonight or are watching this meeting at a time that works for them. We need you to help us build this accessible, integrated, beautiful state where people with disabilities and those who are deaf can experience changes that allow us to truly be part of our communities. Thank you for showing up and taking the time to listen and to act and to help us be open to all. We have an incredible lineup from our Vermont Coalition for Disability Rights membership testifying and sharing some of our priorities tonight. And so at this time, I'd like to turn the program over to our facilitator, longtime advocate, attorney, and protector of disability rights, the Executive Director of Disability Rights Vermont, Lindsay Owen. Lindsay?
Thank you, Sarah. You're going to be a tough act to follow, but as Sarah said, I am Lindsay Owen. I am the Executive Director at Disability Rights Vermont. I use she, her pronouns. I'm a white woman with medium length blonde hair, and I wear glasses, and I have a blurred background. So for the rest of the evening, we'll be hearing from members of the community and organizations, each with an interest and related to one of the platform items for VCDR. If people need a copy of the complete VCDR platform, please email vcdrvt@gmail.com. We ask that you hold your questions until later in the evening or put them in the chat, and near the end of the event, we will address questions or comments. Please keep in mind that some of the stories that you're going to hear today are personal and some quite difficult to tell. We ask that you be respectful of one another, and also that if you need to step away for your own well-being, please do so. We have a lot of speakers this evening, and so Nick Morlan, Executive Assistant for Vcil, will be helping me keep everybody following along to the agenda. Thank you for your understanding. We are going to start with Wilda White, who is the founder of MadFreedom, a human and civil rights advocacy organization whose mission is to end discrimination and oppression of individuals based on their perceived mental states. Wilda?
Thank you, Lindsay, and thank you for VCD for including me in this this program tonight. When Sarah started talking about how much she missed Disability Awareness Day, I wasn't quite sharing that missing. I kind of liked the remote, but as she got into her remarks, I was like, yeah, I'm missing that kind of rousing community. That was such an incredible start, Sarah. Thank you for that. And now you're making me miss Disability Awareness Day in person. So I'm going to talk about two bills that VCDR has added to its legislative platform. And the first is a bill that's numbered S194 and H561. And it would create 7 geographically dispersed 2-bed peer respites in the state of Vermont. It would also fund a pilot project that involves linking an existing community center in Burlington and Montpelier with a peer respite created by this bill. The bill requires an appropriation of $3.5 million a year for the 7 peer respites and a one-time appropriation of $250,000 for the pilot program. Peer respites are voluntary, short-term, overnight programs that provide community-based, trauma-informed, person-centered support and prevention 24 hours a day in a home-like environment. Peer respites are staffed by individuals with lived experience of recovery from mental health challenges. There's currently 1 peer respite in the state called Alyssum, located in Rochester, Vermont. It has a 5-day waiting list on average and operates at 92% capacity, well above the state benchmark of 80%. Peer respites are alternatives to visits to the emergency departments, alternatives to inpatient hospitalization, and also serve as a step-down facility from psychiatric inpatient hospitalization. But for peer respites to realize their potential, there needs to be enough of them to meet the demand There needs to be enough capacity in the state. And currently there is not, and this bill attempts to create enough peer respite in the community to meet people's needs before they are in crisis. The second bill is S-195 or H-160, which would create a credential program to certify peer support workers as a recognized provider of support for people with mental health challenges. The bill requires an appropriation of $500,000 to get the program up and running. Peer support certification provides evidence that an individual has met the qualifications to provide peer support to individuals with mental health and substance use challenges, or family-to-family peer support to parents and caregivers of children and youth receiving services for mental health, substance use, and other service systems. 48 states and the District of Columbia have adopted peer support certification programs. It's Vermont and South Dakota are the outliers. One of the benefits of a certification program is that the services provided by peer support workers could be paid through Medicaid. And Medicaid is a program that is partially funded by the federal government. For example, under the current formula, for every dollar the state spends on healthcare for people eligible for Medicaid, the federal government adds an additional $1.68 for a gross of $2.68. Both these bills together address the long waits in emergency departments for psychiatric patients, the problem of people getting stuck in hospitals because there are not appropriate step-down facilities, the problem of not enough mental health workers available to staff in designated agencies and psychiatric hospitals, and the problem of people having to wait until they are in crisis before they can access services. I've heard it suggested that the state should not fund programs such as these until they fully fund the designated community mental health agencies, because those agencies are in crises, both because they're under-resourced and because of staffing challenges. My response is that the state needs to do both, and that the state's underinvestment in community-based, recovery-oriented peer support services is part of the reason why the designated community health agencies are struggling. Just as you cannot address the problem of traffic congestion by building more roads, you cannot address the problem of emergency department wait solely by building more hospital beds. Just as we need alternatives to driving to address traffic congestion, we need alternatives to the traditional mental health system to address the traffic congestion in our emergency departments and inpatient psychiatric hospitals. Our current system tends to treat mental health treatments as a life raft that you access when you're in crisis. In contrast, peer respites and peer support work as a bridge to a full and meaningful life. Thank you.
Thank you, Wilda, so much. That was really
Eric, gotta watch.
nice. Nick, could you help make sure that people are muted for me? So next we're going to move on to Steve Pouliot, who is the Executive Director of Vermont Association for the Blind and Visually Impaired.
Okay, well, good afternoon, everyone. I am Steve Pouliot. I'm a white male. I go by he or him, and I have white hair, and I'm wearing a white shirt with a gray sweater. So I'm talking to you a bit today about a program that we really feel we need to bring to the visually impaired neighbors that we have in Vermont. Our goal is to try to keep people independent and to remain active in their homes and community. We are able to do this through rehabilitative services. They might want to learn how to cook, how to clean their house, you name it, a whole variety. We teach them the white cane, and how to travel safely in their home and around their neighborhood. And we have low vision devices that will help with that as well. One thing we are not able to do, however, right now is to work with them for the accessibility features and the helpful apps that are on their iPhone, iPad, and other Android devices that would significantly improve their quality of life, as well as decrease their sense of loneliness and isolation. This has always been an issue with the visually impaired, but we were unable to achieve the funding to carry out this program. Then when COVID hit in 2020, many people, not just the visually impaired, experience what our clients have always faced in being socially isolated in their home and the toll that it can take on them for their health and mental well-being. For our clients, it was even worse, as due to social distancing, stay-at-home orders, and the fact that their family and friends could not visit them just furthered their isolation. Fortunately, the state stepped in, recognizing this fact because we had approached them about this training, and they approved a $100,000 grant for both fiscal year 21 and 22 with some of the COVID funds that they had received to start programs like this. It was really helpful to a number of our clients. With that, they could use their devices and learn how to use them for a wide range of needs. Some of the training that they received was to use the accessibility features on their computers or smartphones, using voice-operated commands of smart devices to gather and seek information, accessing telecommunications, including the ability to gather information on the webs, make phone calls, video conference, email, and text. A lot of these things we take for granted, but for someone who's visually impaired, and most of our clients are elderly, they were never really exposed to this and is all new to them. They could learn to access emergency alerts communicated by local or state authorities, manage their finances, prescriptions, and access medical care via telehealth appointments. These are just some of the things that they could learn that we could teach them. And this is especially important. Some people would say, well, can't their family help them and show them how to do this? But sometimes the patience gets a little short. And with our seniors, they might have to be shown a number of times, and they hate to ask and repeat, oh, could you show me how to do this again? They don't worry about that with us. As many times as it takes, we will work with them. They don't mind asking us. We were pleased that in 2020, we were able to serve 150 clients. And in 2021, we doubled that number to about 300. Unfortunately, however, this funding ran out at the end of 2021. The need still exists, however, and will continue to be needed even after COVID is somewhat behind us. So because of our aging demographics, we need help from the state to support the service and to make the funding permanent. We are therefore seeking $100,000 in ongoing annual funding. We have proven that the skills they learn have kept them socially connected, informed, and has improved their quality of life. One very short story I'd just like to share is a woman in her late 60s recently lost her sight due to diabetes. She decided to move to Vermont to be closer to her sister, hoping her sister could maybe help her. But when COVID hit, she was very limited in her ability to spend time in person with her sister, and it was difficult to communicate with her. With her recent sight loss, our teachers worked with her to fully access her smartphone. Through the use of voice commands, she could dial her phone and spend time with her sister virtually. The voice commands also allowed her to set calendar appointments. She was able to both read and dictate emails and text messages to her family, friends, and doctors. She was able to set alarms and reminders when cooking or needing to take medication. While learning to use a talking label wand in combination with a seeing app on her phone, she realized she could now organize a lot of her own personal care, such as skin care, hair care, and other things like this independently. So even though she was afraid to be alone, she now knew that she could be independent and stay connected with others with the skills and technology that she was learning. Thank you.
Thank you, Steve, and thank you for sharing that story. Next, we're going to move to Val Hughes, VCIL Deaf Independence Program Coordinator.
Hi, my name is Val Hughes, and I'm the Deaf Independence Program Coordinator for VCIL. And I am working with the hearing aid bill with a number of other organizations, and we're working to try to get that bill passed through the legislature this year. And we've been meeting for quite some time every 2 weeks, and we've been writing letters to legislatures and trying to get their support. Vermont is the only state out of all of the New England states that has not yet passed some kind of insurance coverage for hearing aids. So we need to change that. And this bill addresses that. So if I want, hearing aids, I'd have to get coverage through, my spouse, because his insurance is through another state. So, but without any kind of insurance coverage, they're just cost prohibitive. And anyone with insurance in New Hampshire covers everything. And I have a coworker who has insurance coverage through New Hampshire, and they were telling me, everything's covered. And I'm like, it's so frustrating to hear. My dad is hard of hearing, and he has to use hearing aids. And he got some help getting hearing aids through VR because he needs to have the hearing aids for his work. But there is, some testifying that's happening this week around this issue. VCDR and the Vermont and VCIL will be giving some of that testimony. So I'm looking forward to being able to make people aware of this issue and hopefully get some support to get this passed. So I would encourage everyone to be in touch with your legislatures about this important bill. And it's on the VCDR website with the contact information and the name of the bill. Thank you so much for putting that in the chat.
Thank you so much, Val. I do have exciting news that I got from Sarah shortly before today's event was started. And we were informed today that the Department of Financial Regulation, along with other partner agencies, did recommend that hearing aids, including hearing exams, be added to the EHB benchmark plan. As Val had said, currently Vermont is one of only 2 Northeast states which does not offer hearing aids. So not only would this additional benefit align Vermont with our neighboring states, but it would increase the affordability and accessibility of hearing aids for those who have hearing loss. The Department of Vermont Health Access will propose the recommendation to the Green Mountain Care Board for approval, and if adopted, it would be effective for qualified health plans in the small group and individual health insurance market in plan year 2024. If you'd like more information, please contact the Department of Financial Regulation, and I can put that email in the chat. I just wanted to give people that update that we got today. So thank you again, Val. We are going to move on to Karen Price, who is the co-director of Family Support of Vermont Family Network, and Kirsten Murphy, the executive director of Vermont Developmental Disabilities Council.
Yes, hi, thank you. So I am Karen Price at the Vermont Family Network. At the Vermont Family Network, we have been hearing from parents of young adults with intellectual and developmental disabilities about the adult services cliff their young people face upon exiting the school system. One of the main concerns is where their dependent adults with high support needs and limited in their ability to express and protect themselves would live after their parents are no longer able to care for them. Parents realize that under the home and community-based services waiver, there is a lack of housing choices available for their adult children, and that the one offering, shared living or adult foster care, is inadequate for adults with moderate to high support needs. Kirsten?
Sorry about that. Hi, I'm Kirsten Murphy. Just quickly as a visual, I'm a white woman with glasses and short cropped white hair, and I use she, her pronouns. So at the Developmental Disabilities Council, we hear similar concerns from parents who have a family member with high support needs. But we also hear from many self-advocates and families across the whole range of support needs. Some self-advocates tell us that while they love their parents, they long to live on their own in an apartment with support. And others tell us they would like to live with a peer so they can share household chores and expenses, much like any other housemate arrangement. But they're not able to do that because in the state of Vermont, we haven't chosen to access a common workaround so that two people in a household can both have a Section 8 voucher, and no one has to give up their Section 8 voucher. And in still other cases, we hear from individuals and families who would like the shared living model to be used more creatively and to have stronger quality controls. What we hear throughout these stories is the desire for more authentic choices. Karen?
Okay, so we're looking for new housing models with new funding for home and community-based services. VCDR believes that individuals and families must have a diverse range of stable housing options for recipients of home and community-based services. We will work to educate legislators and policymakers about the need for Vermont to develop equitable housing plans that offer a menu of housing choices for adults with developmental or intellectual disabilities to enjoy the same stability, freedom, and peace of mind afforded to other Vermonters in alignment with HCBS requirements. We call for immediate action by the legislature to set aside funding and to direct the Agency of Human Services to work with state housing organizations and stakeholders, including families and self-advocates, to develop and fund at least 3 new service-supported housing models. These model projects must collectively address the full range of support needs presented by Vermonters with disabilities who are eligible for home and community-based services. The Vermont Developmental Disabilities Act states the core values in which the Developmental Disability Services System was founded. These principles include the following: full information, individualized support, meaningful choices, health and safety. The home and community-based services are almost entirely funded by Medicaid, 97%. Medicaid is a state and federal partnership where both parties share the cost of services. For this reason, Vermont has to follow the standards set by the Center for Medicaid Services, or CMS. Kirsten?
And speaking of the Centers for Medicaid Services, in 2014, CMS published a new set of administrative rules that were intended to define what living in the community meant. And some of these rules were in effect immediately, and the rest will soon be in force. Throughout the CMS rules, the right to choice is strongly emphasized. For example, the first part of the rules focuses on person-centered planning, and it describes, among other things, how the process of person-centered planning will offer an individual or the individual's parent or guardian informed choices regarding the services and supports they receive and from whom. The second part of the rule talks about the types of settings in which individuals can receive partially federally funded home and community-based services. Again, the emphasis is on choice. People must be offered a selection of options, and some of the rule even goes into details like an individual has the right to have people visit them at a time of their choosing, and assurance that they can have full access to the food that's in the household, and even lease-like protections so that they can't be asked to leave the setting on short notice. It's fair to say that these types of protections and freedoms do not universally exist in the shared living arrangements that we see today in developmental services. Karen?
In closing the doors of the institution, opening the hearts of our communities, a booklet written upon and about the closing of the Brandon Training School, the conclusion states, in the years ahead, we must be careful not to settle into a particular way of providing services. We must continue to change, to give people what they want and what they tell us they need. The state must affirm its commitment, both to people with disabilities and to the people who support them with services. We need to figure out ways of enabling individuals and their families to become involved in decisions about the services we offer. We need to continue to prove to the community at large that making life better for those with the most intensive needs makes it better for all of us. Thank you.
Thank you, Karen, and thank you, Kirsten. We're going to move on to a video that was submitted from a gentleman in Brattleboro. Nick, could you help get us set up with that?
Yeah, we'll be right there. I'm just getting the interpreter.
And just a reminder that we will be saving a good portion of time at the end for questions. So if anything comes up, please jot it down, put it in the chat, or just hold on to it in your memory.
Hello, my name is Nick Russo, known as Nick. I'm a recovering addict for about 4.5 years now. I'd like to tell you about the journey that I've been through and the incredible importance of communication through that journey. About 5 years ago, I began my recovery by entering a rehab to detox, get the drugs out of my body, and to be able to talk with doctors, nurses, psychiatrists. But while I was there, I was told, well, sorry, you're going to have to hold off on that communication because there's no interpreters available. We can write back and forth, right? And I said, no, that is not going to work for me. It's not going to be clear communication. So for a couple of weeks, I was splayed out, very, very ill, with no treatment provided as I went through detoxing. It was impossible to work with a psychiatrist without an interpreter. I needed to sort through what my issues were and needs were. After 2 weeks, they finally got an interpreter for a very, very short period of time. They went through a really quick assessment. I didn't have the opportunity like other people to sit down with a psychiatrist and talk about my needs, both physically, mentally, and for medical treatment. So for me, my recovery experience was stolen from me. There was a real need for communication access. From there, I went to a halfway house, which is a place that's great for early recovery. You can be there for up to a year. And I entered the place. They had groups every evening, and you were required to attend. Otherwise, you'd be thrown out of the house. But again, there was no interpreter availability. And I kept asking, I continually was told no one's available. I have no way of knowing what the true story was about there. After a couple of weeks, they decided to make do with another resident in the house who could sign a little bit. And I said, no, I'm not really comfortable with that. This person needs to be focusing on their own recovery. It requires a lot of self-reflection and self-investment. And so they were stealing from his recovery as well. But the program kept applauding this person and continued to use him as my interpreter. And again, said there's no one available. I didn't have a chance to really express myself, and I needed more access. And even an interpreter doesn't solve things 100%. Well, after a month without real interpreting services, I was unable to access true treatment. Communication was simply not there. Well, it happened around then, there was an event in the deaf community, a softball game, and I was really excited to be able to go to that and finally have some access to communication. And I let the halfway house know, I'm going to go. They said, no, you cannot because there's group tonight. And I explained to them, I am highly isolated for this past month, carrying all this heavy load. I'm going to simply relapse without some communication access. I really, really need to go. And then they said, oh, well, suddenly we have an interpreter. I was like, now you have an interpreter? But I have to admit, I rebelled a bit and I headed out to the softball game anyway. I came back, I felt so much better. I was feeling good. I was smiling. I had communication, and it affected me physically even, but I was kicked out of the program. They just didn't understand the access needs that I had. And it made me realize that recovery for a deaf person, access to all those programs doesn't work without communication there for the whole way. Even at the early part, just to sort through everything that you're going through. After a while, you could do with less communication access once you've been taught the tools and figured out the barriers. But it's critical to have communication access, to unload with the psychiatrist, to unload with the counselors. But they just didn't understand that. And I was not given appropriate treatment. Well, now I'm in college, studying psychology, working on a bachelor's of science, because I want to be able to support deaf people who are afraid to enter rehab or halfway houses. I want to be there as a support, a recovery coach, and to let them know you're not alone. Don't be scared. Going to help you have a more comfortable journey, and also to be able to emphasize with the programs, the need for communication is there the whole way. The mental anguish without that is just too severe. So this is the reason that I'm explaining my journey. The initial recovery was not good. I wasn't able to invest in myself the way I needed to initially. And I want to make sure that that's a possibility for people in the future. I don't want to go on and on. Thank you for your time.
All right, and I think we did have a brief update that Nick wanted to give from Val Hughes.
Yes, this is Val. After this experience, Nick did eventually make it into a treatment program that provided full access to doctors, psychiatrists, counselors, and it was much more effective. And so he was able to flourish. And that is the reason he's in college now, as he said in the end, to continue to support people going through his similar journey. The key to it all, the crux of it, communication. And so he's doing very well now. Kudos to Nick.
Thank you, Val. Next, we have Ada Lyman from Northwest Counseling and Support Services of the Vermont Care Partners.
Thank you, Lindsay. And thank you everybody for having me here tonight. So my name is Ada Lyman. I am a white transgender woman with long brown hair and a white and yellow striped shirt. So now, and I use she, her pronouns. So now a little bit about me, a little background. So I've been working at NCSS for almost 2 years now. And I got my start doing direct services. Oh, just let me see, there's a message popping up. Okay, sorry. So I worked in direct service as a behavior interventionist in the school-based autism program. And there I worked one-on-one with an individual to kind of help him access his communication skills in a more constructive and appropriate manner, rather than resorting to behaviors such as hitting, pinching, or tantrums. And this, that particular position really helped me a lot to better understand just how integral communication is to the human condition and how much that communication can impact a person and make that person feel connected with their communities. So since then, I've taken a new job as a service coordinator in developmental services, where my job is a bit broader and allows me to work with a much more diverse group of adults with developmental disabilities. So now, according to the Vermont State Department of Health, nearly 1 in 4 Vermonters is reported to have some kind of disability. 1 in 9 has multiple disabilities. Whether those disabilities are physical, intellectual, or developmental, they can make it difficult for Vermonters to get their basic needs met. Housing, food, and employment are all things that able-bodied neurotypical people often take for granted. But our peers with disabilities face many roadblocks in accessing these necessities. And that's where our system of designated and specialized service agencies comes in. My colleagues at NCSS and I, as well as those at our sister agencies across the state, work tirelessly day in and day out to help those we serve to access the tools they need to live healthy and fulfilling lives. It's our job to help these people to find stable housing, employment, access to healthy foods, and enable them to make meaningful connections within their communities. But that's been proving to be incredibly difficult over the last few years. Across the state, we're looking at a 30% turnover rate in human services jobs. Those in direct service jobs are facing an unprecedented amount of burnout, and that's being felt by those we support as well. For those of us in case management, we're experiencing less support and higher caseloads. And I've heard from some of the folks that we help that the inconsistency of staffing has had a majorly negative effect on their progress toward their goals. At our agency alone, we have 160 hours of unmet community support in developmental services, which is the backbone of our organization. So many of our services include support in the community, and not having the staffing means far too many Vermonters are stuck at home, isolated and frustrated. We need to change this. Increasing funding for our nonprofit agencies would allow us to pay a more competitive wage to our direct support staff, which in turn would work toward lessening the workload of those who have stuck around through this unprecedented time. So these people pour their hearts and souls into the work they do, and it's time we show them how much their work is appreciated. Thank you. So now I'd like to introduce David Frye, who would like to talk a little bit about his experiences. David?
Hi there. My name's David Frye. I shaved head, got glasses, have a black sweatshirt on. I have services through Champlain Community Services, and what it's really been for me, I really wanted to start a GLBTQIA group up for people with disabilities, and I couldn't do that because short of staff. And then I have a community access person every Monday, and I had this one girl pretty daily coming to my house, and she said to me, she said, I can't work for Champlain Community Services anymore because I just don't get paid enough. And so David, I gotta let you go, and I gotta move on to getting another job that is gonna pay me more. So, you know, so then what that does for a person not getting those community access, getting that services every Monday, or, you know, it really sets in depression. It sets in, you know, like you're not wanted anymore. You're not needed. It confusion. And these people that come to my house and work for the agency, they really need to get paid a reasonable amount of money that so they'll stay with the agencies. And you know, these people are worth it because they help us with disabilities. we need them. And it's when we don't have them, depression falls in, and isolation, and it's just not a good thing. And these people really do need to be paid more. So please help these agencies that we need the help. They help us every week, and they need to be paid enough so that they can stay working with the agencies. So thank you for your time.
Thank you, David. Thank you so much. And thank you, Ada, as well. Now we're going to move into some access to justice issues. As we all know, people with disabilities have historically been abused and oppressed. They're more likely to be victims of crime, and they have experienced numerous barriers to enjoying the basic rights afforded to all individuals, like the right to an education and the right to have and raise children. The next few speakers will touch on these difficult and personal inequities. It is our hope that these stories will motivate Vermont leaders to rise to the occasion and fight for justice for all Vermonters. First, I'd like to introduce the parents of a young woman who is the victim of a crime and the experience that they've had.
I would like to go first, please. So the following is a sanitized version of a statement I requested to be read to the judge at our first status conference in November, and then my thoughts since then. And it was titled State versus the Rapist Status Hearing, November 2021. DNA says the rapist cannot be excluded as the biological father of the baby. 269,700,000,000 to 1. Rape, or as it was on the charge sheet, aggravated sexual assault and sexual abuse of a vulnerable adult, and murder are the worst crimes in our society. And despite being charged and the evidence being great, the rapist was allowed bail to work, share the freedoms of law-abiding citizens under the supervision of his mother with conditions. My daughter, not MF, which was on the charge sheet to protect her identity, and I'm honoring that for her and our family, on a court document, was a victim of rape. She's now 35 years old and has been disabled her entire life. She requires full care, feeding, personal care, administering of medicine. My daughter is nonverbal. She has cerebral palsy, epilepsy, and has undergone 3 spinal fusion surgeries due to infections that almost killed her for scoliosis. She can't walk and is wheelchair bound. She requires physical transfers and sees multiple physicians to maintain her health. She can't give verbal consent. She can't tell us how many times she was violated. She can't physically fight back. Despite this gross violation of her person, she has been in overall good health despite the multiple health challenges listed. This is due to the care plan in place, her guardian and father coordinating care, her HCS caregiver, and respite provider. A retired nurse provides care every other weekend through Dale High Tech Nursing. My daughter cannot agree or disagree to any questions or requests. My daughter was raped and lost a child. 2 traumatic events in themselves. She did not ask for this, but must live with it for the rest of her life. She can't seek counseling. She can't process or communicate this trauma with anyone. She's been grinding her teeth almost nonstop since this occurred. She was in court that day to face her abuser, the rapist. He is not in jail, so why is he allowed to attend by Zoom? Her HCS caregiver has blamed herself since this happened and shared that her greatest fear has always been something happening to my daughter under her care. She had no knowledge of the abuse and has done nothing except provide exceptional care for my daughter, adding to my daughter's quality of life despite her many challenges. All of this has caused the caregiver to seek medical care for her own aggravated heart condition, anxiety, and stress. She's having difficulty herself finding a trauma counselor and finding it hard to do her job. Due to this trauma, she decided that she can no longer care for my daughter, which is my daughter's loss. The rapist. The rapist has two prior Vermont convictions for sexual assault with a victim under the age of 16 and a sex offender registry, failure to comply. He also has a federal conviction for drug distribution. My family. I failed to protect my family. We're a close family, so this has affected all of us in some manner. I served 30 years protecting our nation, and this has happened in my own family. I failed them. After years of keeping my daughter away from the rapist, I finally allowed him to be around her, as she was always with a caregiver. I feel disappointed in his selfish decision, betrayed and manipulated. He violated my trust and the trust of our family. He especially hurt my daughter, her caregiver, my entire family, and his own family, as he's the father of 2 young children. I can't process this with my daughter. Her health and well-being were put in jeopardy with this unwanted pregnancy. Her health care plan is completely shattered. This has affected my relationship with my wife and her caregiver. I found out this happened by my caregiver bringing my daughter to my house with my daughter's dead baby in her brief at midnight. I was a suspect, as my daughter spends most nights at my house. We had a nurse in my daughter's room for the first time in many hospital stays. All males in my daughter's small circle of family and caregivers were suspects. We were not notified that we could be at the arraignment nor provide any input to the state's attorney. We were shocked, in complete disbelief, and disappointed and afraid when we found out he was released. Now we must properly bury the baby when the state's attorney finally releases the remains. I had to wait for a month to tell my family, my mom and 5 siblings, what happened to my daughter. I do not sleep well since this happened to my daughter. I have anxiety and a rage inside me that I must contain every day. This requires counseling for me, for my wife, trauma counseling. The HCS caregiver is having difficulty finding a trauma counselor for her in this case. The rapist being out in the community creates a situation for possible confrontation with my family. The court expects me and my sons to do the right thing and allow justice take its course if we encounter him. I live 2 miles from the caregiver, and my sons live less than a quarter mile away. He's driven through town less than 300 feet from the caregiver's residence under his mother's supervision and stopping at the local corner store 312 feet away. And it just shows a lack of judgment and blatant disregard for the conditions imposed by the court or our family's health and well-being. A few questions for those who are listening now and anyone else willing to listen. Could the court please define residence? Is 300 feet from the property line or your house? I still haven't been given the legal definition. Would anyone at today's conference think it's okay for someone charged with rape of their daughter, sister, mother, or other significant female under any circumstances be out of jail awaiting trial? To include the rapist if it happened to his young vulnerable daughter. DNA, 269 billion, 700 million to 1, says the rapist is the father of my daughter's baby. We have held and convicted people for murder and rape after years through DNA evidence. So why was bail granted for the rapist? With 2 prior convictions, sexual assault, victim under the age of 16, and sex offender registry failure to comply. I do not understand. These are my thoughts since our status conference in November. And they're following are instances that continue to re-victimize my daughter and her family. My daughter and myself father and guardian, my wife, my daughter's stepmother, sat in court November 21st so we could face the rapist. That did not happen, as the rapist's attorney advised him that his time would be better spent at work. Our attorney asked the court to reconsider the rapist's bail, as we were never notified that it was my daughter's legal right to be at the rapist's original arraignment. To date, a decision has not been made either way on this motion. So we all hung in limbo while the rapist continued to live his life, spent Thanksgiving, Christmas, and New Year's with family. Like nothing ever happened. The decision has been made now denying my daughter's motion to review bail. The judge ruled that she has no standing. My daughter can't process this heinous crime with anyone. We are looking for any sort of support to help her cope with the rape and subsequent loss of her stillborn child. Meanwhile, the rapist remains free, living his life with minimal impact. My daughter's care plan has been obliterated. Her father, guardian, and Howard case manager are doing their best to find coverage, but the current employment situation in Vermont is dismal and makes it difficult to find competent caregivers to meet my daughter's intensive needs. This situation was not created by my daughter, her caregiver, or her father and guardian. Her current care plan is far from adequate. It impacts her normal quality of life. In the interim, her father and guardian is filling in, doing it to the best of his ability. The added stress to my daughter's home and family is real. It's affecting her father guardian's ability to work, focus, and is putting a strain on his relationship with his daughter's stepmother. Every time we go out into public, we must wonder if we're going to see the rapist out free like nothing happened. How will I react? How will we react? We have been told the police to call the police if we see him. Why? His current conditions allow him to go to work alone and anywhere else with his mother. So this advice only reminds us that my daughter's rights were trumped by the rapist's rights, and the state is allowing it to happen. Law enforcement, the victim's advocate, my daughter's disability rights attorney tell us the laws need to change and say blame rests with the legislative branch. That the laws have made it harder to seek justice for victims. I find this hard to believe. I have only told my immediate family and about 20 of my closest friends what we've been dealing with since September. Only 2 contact me weekly to check on me, one by phone and one by email. This is a very lonely and disappointing feeling. The one that calls asked me what he could do. He calls because I told him to pray for me so I don't end up in jail for getting my daughter the justice she deserves, but leaving my daughter without her guardian and care coordinator. Bad things happen to good people like my daughter every day, somewhere in the world. I believe in our system of justice. However, rapists, like murderers, are not wired correctly. They will reoffend if given the chance. I volunteered to protect this country and every one of you. I serve to fight for those who won't and those who can't, like my daughter. It's a sad day when good people stand by and do nothing once they know a crime was committed. It's worse when those whose job it is to see justice is served fail to protect the most innocent and vulnerable. DNA says the rapist cannot be excluded as a biological father. 269,700,000,000 to 1. So we ask you in the court, where is the justice for my daughter and her family? When will my daughter see justice? Thank you.
Thank you. Thank you very much for sharing that very powerful story. And I just want to be mindful of everybody's time, and I really appreciate you sharing. I know that must have been very difficult. So I just want to take a moment, and if folks need to take a big deep breath, please do that now. We do have a couple more stories that people wanted to share. And then we will hopefully have a few minutes at the end to ask questions and to share a little bit more amongst the group. But We're going to move on and have a parent speak who's had some experience trying to advocate and within the school system for her son. So I will pass it away to Courtney.
Hi, everybody. My name is Courtney Quinlan. I use she, her pronouns. I am a white woman in a pink sweater with long, wavy, dark hair. My son is currently 17 years old. He has diagnoses of autism, ADHD, anxiety, and separation anxiety. When he was in 4th and 5th grade, he at the time was not being provided with a paraeducator. And he was afraid to go to school. It started affecting his anxiety to the point where it was making him physically ill. He was vomiting and having diarrhea in the mornings before going to school. I was concerned. I brought him to the doctor. The doctor wouldn't write a note stating it was related to anxiety. I brought him to a psychiatrist. The psychiatrist wouldn't write a note stating that those were symptoms related to anxiety. I had no medical basis to keep him home from school based on that. And I did anyway, because I was not about to send my son to school in a panicked state like that when he didn't feel he was receiving the help that he needed. He presents very atypically to an extent. He holds up everything inside, so people can't often tell if he's having anxiety or feeling stressed at school. After countless and countless meetings with his school team at that point, I was told that I would likely be receiving a notice taking us to court for truancy. I could do at the time. I received the notice in 2014 in the middle of July, stating that I had 2 weeks to prepare myself to go to court up against the District of Burlington. So I scrambled and was able to get a copy of his full school transcript in the middle of the summer I ever had any experience with. I was terrified. The notes at the bottom always said, worst case scenario is DCF can get involved and your child can be taken from you. I am my child's only parent, and that is absolutely terrifying to hear or read that. I was lucky enough to be able to get a little through the disability law project point, who just happened to have a grant work from OTs, PTs, therapists. He was about 4 years old, to show he was home with me when he was not at school. The school insisted that I bring him to school anyway, even when he was sick, stating that he got better as soon as he got there. That was a lie.
Courtney, I'm so sorry, Courtney.
On vacation,
Courtney,
my son was not sick. On the weekend, my son was not sick. It was only
Courtney, I'm so sorry. Your video was, you were cutting in and out. So maybe if you turn your camera off, you can have another couple minutes to talk about your story. Thank you.
Sorry about that. So by the time we got to court, I had had 2 weeks to get this information together. I had been told that my son had to show up at court. He was 7 or 8 years old at this time. I was repeatedly told that the judge and other people, including his own lawyer, who I had to pay for, would be telling him that if he didn't start going to school more, that I could get in trouble and I could go to jail. And he really needed to start to go so his mom wouldn't get in trouble. I specifically asked them to stop saying this to my son. His anxiety and made him afraid of everybody at school and everybody in the court system. Our process lasted about 6 months. We had to go to court 3 different times. Every single time they used the scare tactics with my child. Every single time I left the court and basically told him that they were lying to him and that that would never happen. Luckily, after 6 months and the 3rd time that we went, they dropped the case. If they had not dropped the case, we were about to sue the school district for discrimination and file due process. This greatly affected my son. He was terrified of going to public school. His situation got worse and worse year after year. I kept receiving the same letters year after year. And I just kept saying, okay, take me back to court then. There's nothing else that I can do about this. They didn't end up taking me back to court. Eventually, the school district agreed. I am now happy to say that my son has been at an alternative school for the last 2 years. He has 0 issue with attendance. He loves going to school now. He is on time. His grades are doing great, and he is treated like a person and listened to, given the help that he deserves. I thank you for your time, and I strongly urge you to consider making legal availability for parents of children with disabilities dealing with school and court system.
Thank you so much, Courtney. Sorry about the technical difficulties, but thank you for sharing. And we will figure out a way, both Courtney and another individual who had volunteered to provide a story did provide a recorded statement as well. And so we'll find a way to get that to folks if people are interested in having those fuller versions. Please email Nick. Nick, I'm going to volunteer you, nick@vcil.org to get copies of those, and we'll try and make sure you're able to hear their stories in full. The last individual who is going to share with us this evening is a parent who has disabilities. She has agreed, in light of the time that we have remaining this evening, to allow me to summarize what she experienced. And of course, I would encourage you to reach out if you do want to see the full recording of her statement, because it is very powerful and pretty heartbreaking. It touches on what Sarah had raised in her opening remarks around a person not being able to raise their own child solely because they have a disability. Alice was a young mother, had taken several parenting classes, getting ready for the birth of her daughter, and after difficult labor, was able to give birth to her daughter. And the next day, while still in the hospital, 2 men showed up and said that DCF was going to be involved and consider taking custody of her child. At that point, DCF remained involved in her life, and she has not had any visitation with her daughter in person. Her daughter is now adopted. She is also almost 15 years old. And Alice was never given a chance to parent her own child. This story, and again, we will have the recording available, I think touches on so many of the issues that we are here to talk about today and to fight against, and to really try to change for the state of Vermont. Alice is here with us this evening. If folks have questions, I'm sure she'd be willing to answer those during the question and answer portion of this evening. But again, we do have a recorded statement if people want to hear that in full. Alice went through a lot of hardships, including walking from Williston to South Burlington to get to DCF visits, but never had any ability to be given a chance to raise her own daughter. She's hoping for the day that her daughter is old enough to make those decisions on her own, and that they can be reunited. So thank you, Alice, for sharing your story with me, for allowing me to summarize what you really did an amazing job capturing on your own. And so thank you for letting me summarize your experience. And I encourage folks to reach out to her or to me to get the fuller picture of an incredibly important issue. So again, I wanted to make sure that we had some time for folks to ask questions and to just open up the floor. So feel free to raise your hand, use the raise hand feature at the bottom. You can put questions in the chat box as well. I do also want to mention that we did have a postcard from home from an individual from the Developmental Disability Council as well, but in light of the time, we're not able to share that this evening. But it was a story from a gentleman named Dion Lachey, and if folks are interested in seeing that, we can coordinate that as well. So I will open up the floor, and if people have questions, please raise your hand or say something in the chat. Thank you. I see Paula. You're on mute right now. Give us 1 second and we'll help you unmute. Nick, can you help?
Yep, I'm working on that.
Okay, great, thanks.
Why don't we go to somebody else while I help out Paula?
I think Alice.
I have a question. This is to the senators in regards to legislation in Vermont. When this trial was going on in 2017, in 2007, I had found out this information through. I went on a conference, and it was called Passing Legislation. Well, I shared this with Ed Paquin from Disability Rights Vermont, and he found this law, it's legislation, and it says what it says. I'd like to read to them. It says passing legislation 2007, around the time of this case, all type that covers all disabilities. Summary: the legislation mandates that in child welfare proceedings, there should be an appropriate balance between protecting children and representing the rights of a parent or a guardian, including a parent or a guardian with a disability, recognizing that all people with a disability, parents, and including the possibility of adapting equipment and support. I'd like to ask legislation, as there was a program down in Massachusetts that we would have been the first family to go to this program. DCF and Burlington had waited 1 day late, and there was no openings. I have not seen my daughter in 15 years. I have seen her in 2014, by the grace of God, that I saw her. 2014, me and my friend, we counted the Council on Disability in Washington, D.C. 2015, they sent somebody here, Al Jazeera America, to do a story on me, Dr. Susan Ewan, and DCF. This story went to the lieutenant governor, and the lieutenant governor told me to go to the House and the senators. Well, I did, and their response was that there's nothing they can do. She's adopted. Well, it's your fault she's adopted. What are you gonna do to help parents like me and other parents to compensate for the loss that we have had?
Thank you so much, Alice, for that question. And I know that you touched upon that in your story as well in the recording. And I did want to point out, that Karen Lafayette did put, there is currently a House bill that talks about preserving the rights of parents with disabilities. And I think it's a much larger conversation. It touches on the eugenics issue that Sarah had mentioned in her opening remarks as well. And there really is a need for Vermont leaders to take a stand and to help try to correct or compensate some of the harm that's been done to individuals in our state. And so I really appreciate you asking that difficult question and presenting that to Vermont's leaders. And we'll make sure that we continue the conversation, but there is currently a bill that's being considered to help protect the rights of parents with disabilities. So thank you very much.
Well, I wanted to say one other thing, because this could have protected from me and my daughter being separated. So it's affecting my daughter and it's gonna affect me at the end, all because of the state. And this
Right.
is one state that discriminates against parents with disabilities. And there's other states that discriminate. And it also says in the Al Jazeera report, if people would like to see it, that there's 80% of parents with intellectual and physical disabilities that the states use as a strike against us. So if anybody would like to see my Al Jazeera report, I would highly recommend that, because that's how this story got to the state of Vermont.
Alice, why don't you, if you're able to, why don't you put your email in the chat? And if people want to get that from you, then people can do that. I think that would be a good resource. So why don't you do that, and then we can try to move on to Paula.
Sorry, yeah, Paula is, I think, ready. Paula, can you give us a short comment?
Yes. My partner and I have been separated for now nearly 2 weeks. Both of us have been having increase of health problems, and I hate to say this, but there needs to be more peer advocacy counselors available to cover each and every county the state has, because more of us who've been through Vcil services are having to get reconnected to overcome many of our difficulties. Thanks to Nate Vcil, he helped with programming my laptop so I could be on tonight. It just needs to be more peer advocacy counselors available, as I said, practically in every county. Chittenden could use at least 6 because of the way it's spread out. It needs that many so people don't fall through the cracks and end up having done things that aren't supposed to be done.
Thanks so much, Paula. Really appreciate it. Anybody else who would like to share briefly? This is Nick. Lindsay, do you want to, I think we can do your closing remarks then?
Sure. All right, well, thank you all so much for being here for either all of this event or for some portion of this event. It means a lot to me and to others that have helped organize this event, and to just the community members. So thank you for sharing and for listening to these important issues. While each of us continue to persevere and push through this pandemic, we cannot lose sight of those around us. Every single one of us deserves to be heard and to be helped. This pandemic and other national and international events have shown us that while we are all vulnerable, there are people in our communities that face unnecessary risk of harm and oppression simply because of who they are. But tonight we've heard that there is hope and there are opportunities. I hope that each and every one of you will leave here this evening and commit to tomorrow and to each day after that to be a part of the solution. That Vermont is and will be open to change and open to all. Thank you very much. And good night.